Hi, my name is Brandy Stoll. Today I'm doing my persuasive speech on abstinence and safe sex. This is for Communication 101. 1 of 4 sexually active teens have sexually transmitted disease. 70% of them have no symptoms. Look around you. Can you tell someone sitting by you has an STD? No, you can't. Most people find out they have an STD on accident when they have their yearly physical exam. The need for abstinence and safe sex practice is to reduce teen pregnancy, spread of STDs, and emotionally protect our youth. We need to educate adolescents and young adults the choices they have when it comes to being sexually active. As a nurse working infection control, I like to educate you on the importance of safe sex and abstinence. Lack of accessibility to safe sex and abstinence education creates a dilemma for our youth and increases STDs, teen pregnancy, and depression. According to the CDC, 15 to 24-year-olds represent only 25% of the sexually experienced population, but they have acquired nearly half of all the new STDs yearly. You don't have to have intercourse to spread STDs. You can spread STDs through skin-on-skin contact with an affected area or sore. According to Our Vices, Our Lives, Our Futures, you and STDs, 1 out of every 2 sexually active teens can expect to be infected with an STD by age 25. STDs don't only cause embarrassment, but they can cause infertility if not treated early on, and they also can cause death in the cases of HIV and AIDS. Right now I'd like to show you some pictures of some STDs. This is syphilis on the male genitalia. It's right there. This is a picture of syphilis on a female genitalia, and this is gonorrhea on a female. And then this is a picture of pubic lice, or also known as crabs. The negative effects of unplanned pregnancy can be endless, unless the parent is mature or mature enough to handle the stress and financial burden of having a newborn. In 2006, the CDC identified 305,427 births occurred to mothers aged from 15 to 19 years old, a birth rate of 42 per 1,000 women in this age group. According to Professor David Papone from Rutgers University, half of all teen mothers will end up on welfare within the 5 years of their first child. Papone also states the child of a teen mother are more likely to grow up in poverty, have more health problems, suffer from neglect, abuse, fail in school, and also themselves become a teen parent. Cause of depression from sexually activity is from emotional stress, muddled relationships, and broken hearts that can occur. The National Longitude Survey of Adolescents' Health states that sexually active girls are 3 times more likely to become depressed, and boys are 2 times more likely to become depressed. Meeker, the author of Epidemic, How teen sex is killing our kids, states, teenage sexual activity routinely leads to emotional turmoil and psychological distress. Sexual permissiveness leads to empty relationships, to feeling of self-contempt and worthlessness. All, of course, are precursors to depression. Clearly, there's more that all of us need to do to help our youth with complex decisions of having premarital sex. We need to educate. We need to teach our children about abstinence, talking to their partner about concerns they have before they're sexually active with them. They need to get tested regularly for STDs, and they need to practice safe sex. They need to use a condom with every sexual encounter. We need our parents' support, school districts, and government. We need our parents to go home to their children and reinforce what they believe their children should be doing. We need the government to have ad campaigns to teach children, just like with drugs, what they need to do to protect themselves. In order to do this, we need to have it accessible for these age groups. I like to see school nurses in the school weekly for a couple hours a day, and for an anonymous way for students to ask questions, and that questions could be answered in the newsletters. I want parents to feel more comfortable talking to their children on what they expect from their child when it comes to sexual activity. And a national ad campaign with billboards and public access TV commercials I would also like to see. In conclusion of my speech, I'd like to reiterate the main ideas. There's lack of accessibility to safe sex and abstinence education to our nation's youth. Because of this, there's an ongoing increase in teen parents, STDs, and depression. We need to educate our youth on protecting themselves from others and embarrassment and lifelong problems of having STD, the financial burden and stress of being a teen parent, and the risk and depression that comes from having sexual encounters before they're mentally mature to deal with heartbreak and disappointment. In order to this be accomplished, we need support of parents, school system, and government. I ask for all you to educate yourself on the importance of practicing safe sex and abstinence, and write to your legislators that more needs to be done in the public eye to educate our youth on the harmful effects of having sex before they're financially and emotionally ready. Abstinence is a very personal decision. Each person must use their own judgment and decide if it's right time and the right person. This is very important factors to consider, both physical ones, the possibility of becoming pregnant or getting STD, a sexually transmitted disease, and the emotional factors too. Even though your body may feel ready for sex, there are emotional consequences you might not be prepared to deal with. The youth is our future. Don't let them down because you are too afraid to talk to them about premarital sex. They need to know the facts, not the myths.